Ladies and gentlemen, allow me to welcome you to this webinar entitled Digitalization in Life, a multidisciplinary approach. My name is Tomáš Paulik. I am a Compass Communication Officer for the Technical University of Košice, and the webinar is hosted by the Ulysses Innovation Hub Digitalization, based at the Technical University of Košice. And today's speakers will also come from this university. We will also have an expert panel from Ulysses partner universities. And let me also mention that this webinar is part of the calendar of activities of Compass, leading Ulysses to become European University Excellence Model through Research and Innovation, a Horizon 2020 project of Ulysses and the flagship for its research and innovation agenda and strategy. At today's event, we will see 3 presentations lasting 20 minutes, followed by a 30-minute discussion. If you are watching us via YouTube, you can also write us your questions in the chat, and in the final part of the webinar, we will do our best to answer them. Now, let me introduce the first speaker, who is Radoslav Delina, with his presentation, Data and Their Potential for Next Generation Procurement. Rado, the floor is yours.
Thank you very much. Thanks for the opportunity to share my view on research and development activities of my research team in the field of digitization, especially in this fascinating domain. So please, next slide. Really, this domain is nowadays, it will be only a short introduction into the topic, and then I will move more in deep and present also my view from the point of owner of startups. So this fascinating domain is nowadays undertaking really amazing digital transformation with still higher and higher emphasis on data, but also on its complexity. These days are exciting from the evolution of decision-making automation or new ways of data-driven decision support. So we can say the complexity of supply management nowadays is building on a whole range of different data accessible, not only from internal processes, but I guess mainly from external environment, of course, in different level of quality. And the data aggregation then pushes on data quality and data processing, which is nowadays one of the most crucial aspects of data economy. And also new generation data service development. That is also the challenge for us, data scientists and researchers from academic world. For me personally, it's also the challenge to show practical aspects of research with potential of transferring our analysis into startup or at least new data service deployed on the market. That's why I will start with my presentation of my 2 main startups, building on the open and private data processing and data service development for public and private procurement. Both commercial projects build on my 20 years experience with digital transformation of procurement and its data potential. So please, next slide. So I will start with my first startup project. It's named Transparex, where I am co-owner and I am main vision holder. This project uses open data in different form from public procurement processes here in Slovak Republic. And the main vision was to increase transparency and efficiency of public tenders management together with reduction of unfair practices. So the first main challenge was to aggregate data into one single data warehouse with sufficient data quality And as the main problem of current business software ecosystems is that they were not developed taking into the account data potential. There are plenty of imperfections like weak functionalities allowing users to make mistakes or to submit non-standardized or structured information. Only few examples. In public procurement, you have winner and unsuccessful bidders. Generally, these unsuccessful bidders are mentioned only in full text documents like reports from public procurement written in Microsoft Word, for example. So if we would like to analyze clusters of suppliers or applicants frequently entering in the public tender together, you have no chance, or with application of doubtful semantic technologies with insufficient accuracy. Another problem is, for example, prices or price. Sometimes procurers are submitting prices in total. Sometimes prices are per piece and so on. So that's why our process of cleaning data was the most difficult and time and, of course, money consuming activity within this project. On the other hand, data with higher quality allows you exciting data services or modeling. For example, cartel diagnostics or bid rigging or corruption patterns or prediction of a final price or suppliers submitting offers or benchmarking the efficiency of your public procurement strategy against other procurers or other tenders. That was the main objective of our portal we have developed, and it's already running together with services like diagnostics of personal and capital interconnections between bidders, between organizations, searching for suitable and most performing suppliers within category of products, etc., etc. Now we are in a stage where we are publishing basic analysis, but for example, I propose trust index for supplier, procurer, and tender with risk assessment consisting from 56, I guess, non-standard behavioral signals or patterns. Also, this service is still not ready as it requires really much more difficult research and modeling, comprehensive research where still data have to be processed and have to be cleaned and reliably modeled. So we are still working and developing new models, and it's really fascinating because this aggregation of public procurement data has also potential for commercial procurement. What is my second startup now with working name Data Procure. So please, next slide. So within my research philosophy, I believe that that research shouldn't be closed in the box with one and only purpose to publish good scientific journal, but we have to have clear drive to practical use, and it should be trusted. And it will be trusted only when you will be able to invest your own money in commercialization of your research results, as Taleb said. One of the crucial factors for me, for example, was to meet real procurers to discuss with them my vision, their requirements, data potential, and within this cooperation propose and develop suitable and trusted data services for them. So that's the startup, the Data Procure, which is processing data from commercial negotiations and related procurement softwares, especially software ProAbyss, or nowadays, I guess, the name is Tenderbox. It's the most known special electronic auction or e-negotiation software for public and commercial procurement here in Central Europe. They have hundreds of companies as clients and really 10,000s of tenders, commercial tenders. So I am within this startup. I am processing data with the purpose of analyzing suppliers, their performance, their risk, market situation related to prices, competition changes, analyzing efficient strategies for B2B negotiations or risk for category management. And together, I'm enhancing their data structure with the data from public procurement as a really different world of doing business, and also with other data sources like other from the market, for example, financial statements of companies, bankruptcy cards, and so on. For example, also There is a plan to integrate also commodity market prices as the information about derivative prices, so on. So this service is developed with cooperation with tens of large companies here in Central Europe, based on strategic alliance with this electronic auction software provider, now marketing with most complex negotiation software here in Central Europe. So please, next slide. And also here, the research was and still is crucial to understand data, to understand to achieve its quality, but also the potential of data visualization or transformation into new data services. Data processing we can see from two basic dimensions. First, to show visualization to end user of some status or benchmark analysis as for example, these screenshots from our Transparex portal here, you are able to see on this slide. The amount of data aggregated from different sources provides really amazing opportunity to show information till now impossibly to calculate it easily. Only to imagine these possibilities, I will explain it on merging data from public procurement with the data from financial statements of all select companies. So, for example, when you will merge these two sources, you can analyze the financial situation of suppliers, the date of winning contract, or to analyze their dependency on public tenders or direct dependency on specific public procurer. Or you can analyze changes in financial structure after winning the contract or the closing the contract. This company doesn't transfer the money to subcontractor, and which was not announced in advance in public tender, or you are able to analyze adequacy of financial strength against the volume of the tender and many other indications of possible incorrect behavior. Together, you can analyze numbers of companies and its competitive level within tenders published by specific procurer, or see if savings achieved are not some outlier on the market against other similar tenders within specific category of product type of procurement or its volume to be comparable. And this is only the view of descriptive statistics, but with the power of data aggregation. So on the next slide, on the other hand, we may to provide also or to utilize our research and to provide something like advisory support or alerts for procurer when managing the tender. Doesn't matter if in public or commercial procurement. This model is, I guess, built on commercial data or data from commercial procurement. Here we have analyzed, for example, impact of disrupting fixed suppliers' portfolio on the savings achieved in the tender and impact on competition level in digital negotiation environment like English auction. So, for example, here it's a simple result of decision tree algorithm, namely height algorithm, showing the model when after processing amount of data from different procurers, different tenders, from different situations, it calculated rules, decision rules with probabilities for different procurement strategies. For example, here you see that the decision tree show how the average savings achieved was changed according to inviting different number of new until unknown, it means really new supplier into the negotiation. For example, if you are working with 5 old suppliers for specific product already for 5 or 10 years, it is a probability that the prices will be fixed in time or suppliers will start some collusive behavior. Here we see what will change when we will invite 1 or more new suppliers in different situations. For example, this highlighted blue shape rule, it shows a decision rule when if I will invite only 1 new supplier and I will set up a negotiation by English reverse auction algorithm, I can achieve 10% savings, which is better against negotiation only with old incumbent suppliers, where I am able to achieve only about these 4 4.6%. So there is the question, of course, about the generalization or accuracy, but suitable modeling practices can provide a really efficient set of rules for decision support service, which can be provided or visualized in the form of recommendation or alert message directly in a known legacy system of this procurer when setting and developing his strategy for procurement, for example. So please, next slide. Another very interesting research question was, or with great practical applicability is to model social networks in business here, and especially in public procurement. Here in procurement, it means that you have to know if your example, for example, 3 suppliers you are in negotiation with are not somehow interconnected between each other, because then you will probably negotiate it only with one company, which is behind all these 3 companies and probably is controlling them. Then, of course, the price negotiation, it will be not very efficient and suitable for you. So this modeling is a really nice example how the data scientists may provide very efficient tools which can reveal improper behavior, and in public procurement, it's really also a violation of legal norm. So that's why we developed this service and provided it to public procurers. Honestly, what this is driving financial aspect of our startup. And on the other hand, there is also some challenge. Because when you are transforming your results into user-friendly data service, you have the challenge how to visualize complex relations and not to be lost. Some users, like journalists, are fascinated by unraveling the network relations between companies and persons, but procurers need to know only if there is a violation or not, and to have some report. So for example, we are still considering the right level of visualization complexity, as it's quite tricky and it may be frustrating to the end user, but it also is possible to provide only alert in text format. So, but what about higher level of complexity to show and provide not only this interconnection, but also you are able to provide some evidence about inefficiencies of negotiation with those interconnected companies. How bad it will be? Can I predict the price or bids? Can I disrupt the behavior, and with what result? These are questions which are really fascinating, especially for us, data researchers, but also owners of startup, because our best toy is data. So next slide, please. Here you can see our playground. So you see few visualization of interesting patterns inside the data, because data can really reveal hidden knowledge, which can be very useful to provide the procurer and support him with some diagnostics and disruption strategy to increase efficiency of his procurement strategy. For example, here you see several graphs where we are trying to visualize something in Python. We are examining how increased frequency of the contract with one supplier, winning one supplier, still the same supplier, can affect procurement performance. We are clustering each bilateral supplier-procurer relation to classify the type of trend, and then we would like to focus more on those the behaviors or the trend of longer bilateral relationship, which or with negative impact after some time. So we would like to know what can be predicted if we are able to predict such behavior, this behavior with negative impact. Where is the breakpoint? What can be done to disrupt this negative trend and save some savings through this recommendation. So together, we are increasing complexity of such modeling, where these relations are enriched by examining parameters as fixed portfolio of suppliers entering into the negotiations, bids rotations, many other non-standard unwanted behavior. But this is the beauty of data science. It's great potential to really interesting and practically, I hope, very efficient knowledge, till now almost impossible to find. So please, next slide. And then finally, you will have only to decide how to integrate your research results or model with suitable precision into the end user application, how and when to deliver the knowledge, information, recommendation, or alert to the procurer, in what phase of procurement process, or how to make the decision-making process really fully automated. What is one of the final objectives in my second startup, this data procure. After discussion with procurers or large companies, we have found the possibility to automate, for example, operational purchases, where it's not about the price reduction, or mainly this is not the main objective, but it's more about reduction of errors and moving people to more productive work. So that's my synergy between economic-related research supported by data science and practical innovations suitable for the real world. So here you see some mock-ups where we are integrating our results from data modeling directly into real software for negotiation based on this strategic alliance, as I mentioned. So please, next slide. What I would like to say more to this presentation is that all this analysis and research thinking and discussions lead me to new and really more and more fascinating enhancement of my research for practical use. For example, the idea where we used satellite data for fintech. It's called Vertex. It's already service deployed on the market. And it uses satellite data and data technologies for vectorizing and for classification of buildings to be able to identify unpaid real estate taxes. Or, for example, fresh project where we are now planning to predict the prices of agro commodities, for example, for one large brewery, Asahi, as decision support for their strategic sourcing. Or my favorite project, social procurement, where I'm trying to use data services developed within Data Procure to change the way how or which social criteria could be used and how when negotiating suppliers to support higher social value on the market. It's my dream to provide motivation to use social criteria, which will be automatically validated. For example, if your supplier, or to check and validate automatically if your supplier is employing disabled person, or when you are purchasing some agro production, if it's really organic, which can be validated, for example, by sensors deployed on the side of the farmer, or, for example, where to realize team building to support some social farm, and so on and so on. So that's all, or this innovation are all around the procurement domain, and it's only the view on different aspects of data, how to aggregate and to process and to provide the right service. So next slide, please. As you see behind all of these projects, the data are the main factor of development, and they are, of course, the driving factor of our research, which we consider as to be a cornerstone for high quality innovative services. And as we know, the real world is really complex. It's not a laboratory simplified experiment. It's really complex environment. And these data are really complex. We are open to scientific, but also commercial cooperation. I will be happy if someone will join us with at least this enthusiasm we have. So thank you very much. I hope I was just in time. And looking forward to discussion after other presentations. Thank you.
Yeah, thank you, Rado. It was perfectly timed. The presentation was full of interesting things. Let's stay tense for a while and move on to the discussion after all the presentations. We are looking forward to it, really. Thank you once again. And as the second speaker, we welcome Radovan Hudák, who will speak on the topic digital design and manufacturing in implantology and tissue engineering. Radovan, please go ahead.
Thank you, Tomasz, for introducing me. So my presentation will be with the title as it was mentioned. Before jumping into my presentation, I will start with discussing what are the trends or recent topic in medicine and healthcare from the point of view of digitalization. And I would say there are 6-7 points. First point is big data. It was already mentioned in public procurement, but also in medicine it takes place. Then virtual reality is a big topic. Then artificial intelligence. Very important topic from my point of view is robotics and automation. And big attention is paid already to personalization, and personalization will be trend for the future as well. Last topic is tissue engineering and regenerative medicine, an application of additive manufacturing and 3D printing in this field. And as I'm an expert in this field, I will continue in this topic. And I will describe our experiences and practical applications of our outputs of our research. So on the first slide, you can see application of additive manufacturing. Here are 5 types of application. First application is application on the human body. You see there examples like splints, aligners, dental aligners, ITEs, in the ear devices for the hearing or improvement of the hearing. Second application is invasive application, but short term. It means like surgical guides for dental application, for applications for drilling the holes, for intraossal implants, and for application of endoprosthesis in orthopedic. Third application is invasive but long term. It means endoprosthesis like knee, shoulder, hip, and so on, or teeth, crowns and bridges. It means dental application. The fourth type of application is invasive application, which becomes part of the human body. Mostly used application in this field are 3-calcium phosphates or hydroxyapatites. So these are bioceramic material which are disappearing in a human body after time. And the last applications are invasive, made of human tissues, usually using cells and 3D bioprinting. For digital production, for digital 3D printing, additive manufacturing, of course, you need digital data. At the beginning, there was invention of computed tomography by Hounsfield. Then, 1977, the Median invented MRI, or nuclear magnetic resonance technology, which was used for machines using MRI principle. 81, first 3D model used from the milled slices. 83, Chuck Hull. We used to call him as a father of 3D printing, as he invented stereolithography, first 3D printing technology. Then 88, first anatomy was printed used 3D printing for additive manufacturing. Then first color model in 98. In 2000, first medical applications in the implantology and prosthetics. 2003, successfully separated conjoined Egyptian twins used 3D printed models. In the same year, 3D printing of titanium parts. In 2007, virtual surgical planning started, which also takes place in 3D printing and additive manufacturing, as surgeons are used to use surgical guides. 2008, personalized surgical instruments for knee surgery took place. Then, next year, we was firstly applied 3D printing and additive manufacturing in Slovakia. So it's already 14 years since we started with this topic. And in 2010, it was a big point because it was first time FDA cleared metallic implants applied to a human body. 2013, first implant implanted, designed, and produced at our department. 2014, anatomical models for surgical planning of in hearts, kidneys, and other organs. And what are the future? 3D printing as a surgery assist, production hospitals or manufacturing hospitals, increasing availability of biocompatibility materials, patents expiry, which already happening. Of course, additive manufacturing applied in medicine is interdisciplinary field. You have to act in a field of material engineering, verification, quality management, validation, certification, biomedical engineering, software engineering, design, prototyping, and of course, medical fields, many medical fields. How it works step by step. First, you have diagnostic data, CT or MRI data. Of course, before you have some accident or some sickness of the patient, which should be treated. Then you are creating referential model, bone model. Then you are creating implant, everything in virtual space. Then you are printing a physical model, prototype of an implant. Very important is consultations with the surgeon because they are at the end responsible for the final design. Additive manufacturing, post-processing, implant production, validation, we are using metrotomography, industrial computed tomography, then surgery, and the patient is at the end. It was already mentioned which kind of data are you using. I just want to add that also optical or laser scanners could be used for getting the body surface parameters or digital data, and for inner organs also ultrasonography as a source for the data. And the CT MRI was mentioned already. This is an example of the machine which is working at our company because we produced or established a spin-off company for producing implants in Slovakia. But now we are delivering worldwide. We are using this German machine, but recently you have 20, 30 companies producing machines for metal additive manufacturing production. Here you see some examples from our labs. Of course, we can do all the research on the machines which are commercially available at the company. So we bought some machines which we are using for testing, and they are placed at our university at the Department of Biomedical Engineering and Measurement. Already mentioned diagnostic data computed tomography machine, which is already working at our department 13 years. You can look and verify not only size and other dimensions of the implant, but also you can look into the implant. So you can check porosity and look at the homogeneity of the material and so on. We have also different kind of scanners, both for the scanning and digitalization of the human body, touching probes using coordinate measurements machines and so on for validation and verification processes. Some of the case studies, I really apologize. I will have some bloody pictures from the surgery, but it's necessary to show these pictures. this is how it looks, or how our implants are designed. Of course, you need input data. Then you are making slicing, you are cleaning soft tissues, you get the bone model. Then you are creating the space for placing an implant. The green one is an implant design with the flaps. Then you see the position of the flaps for placing the screws. And you see the patient before the surgery, patient during the surgery, when the flap was opened, an implant, how it was placed, the flap was taken back, then suturing the skin and the patient after the surgery. And this is, on the next slide, is how the patient was looking a couple of days after the surgery and 14 months after the surgery. So you see almost invisible surgery. This was the story of the patient which fell down in Prague from the building, from the 4th floor. He had almost 34% of the cranial defect. He was of the age 30, and it was really a nice story because we helped this patient very much, because he had difficulties to speak, to walk, and to move before the surgery, because he had an implant there which was moving up and down because it released, because probably of the bone degradation of the patient. So we designed an implant for him. This is the patient before the surgery, after the surgery, and you see he can walk, and he started to play chess with his father after the surgery. Before, his cognitive function were on the minimum. One of the largest maxillofacial implant which was placed into the human body so far. We designed this implant made from 6 or 7 other patients. We used computed tomography data, so we collected this implant together according some anthropometrical or biomechanical principles. And on the next slide, you see some of the design, and on the right side, you see the final design of the titanium implant with porous structure. And this implant is covering almost 86% of his face. Another patient, he had some accident at work. He was working in a machine shop, and some tool cut it a part of his head. And we designed an implant. Firstly, we applied holes for drainage, and also holes for suturing the dura from the brain to the implant. You see also positions of the screws. Each screw is defined, and you have the specific length of the screw. And we are giving advice by presence of our engineer at the surgery, and he's talking to the surgeon which screw where to place, how to orient an implant, and so on. Implants after the production, and you see how it's covering the skull and the patient after the surgery. Next, another very interesting implant. This was a 13 years old girl with the bone fibroma of the maxilla. So we designed this extendable implant. So this implant can grow with the patient. So we place there holes with the screws, and using small suture, you will just place a screwdriver inside. You will release the screw, and then you can extend an implant. And we used for the design CT scans of her mother to predict how it will be in a couple of years, or 10, 15 years. And this is the final design, and the titanium printed implant. And we put there butterfly just for fun, because it was really strange story for this girl, just to have a little bit fun at the end. Another big challenge for us was to replacement of the sternal bone in the chest and the part of the ribs. So we designed quite large implant, which was collected from assembled from the 7 parts. This is on the left side is fibroma. It was again a fibroma of the sternal bone. This was cutted by the surgeons and they took it out of the body. And on the right side, it's we call it spider. It looks like a spider. This design of this implant, and this is a prototype made of plastic. This is final titanium design, and on the right side you see application during the surgery. Our specialty is our cervical implants because we were requested quite often by surgeons to design a new implant which will be resistant from the mechanical point of view, because you have in many cases a kind of prolapsion or a kind of damage of the vertebra's body due to the bad design of the intervertebral disc. This is this yellow implant on the picture. And we designed this implant according to the shape of the upper and the lower vertebra body. So the stress is released on the whole surface of this implant. Specialty is this porous structure. Of course, there is a kind of rigidization. So patient cannot move with this part of the vertebra, unfortunately. But this surgery helps a lot for the patient with the chronic pains and the problems with the movement. We do a lot of testing in this field, also topological optimization and mechanical testing and so on to have the final design at the end. This is design of an implant which was placed at the competition here in Slovakia with the chambers, which is light white, and you can place into the chambers bone powder or antibiotics or whatever for better biocompatibility. With our spin-off company and the research behind, which takes place at our Department of Biomedical Engineering, we designed more than 350 implants, and all of those implants were placed into the patient, not only in Slovakia, but worldwide. So almost 400 now implants we produced, and more than 40,000 implants in series, especially spinal implants, which we produced and placed to the human bodies worldwide. Here you can see some examples of our products with our specialty porous structure, different porosities, different kinds of porous structures, applicators for spinal implants, special hip endoprosthesis, and so on. I already have mentioned the future. Future is in this field 3D bioprinting using human cells. And you have 4 levels of bioprinting where you are using non-biocompatible materials. Second level, biocompatible but not biodegradable materials. Level 3, biocompatible, biodegradable, and bioabsorbable, which are disappearing in a human body. And the last level is 3D printing with human cells and printing of living biological compounds in the replacements. This is how it works. I want to say here that this topic and this research field is very important, not only for direct bioprinting of the replacements of the tissues, but you can using also these outputs, printed outputs for drug discovery, drug testing, in vitro disease study. So you can replace in many cases animal models, which is quite often discussed topic. So I see very big future of this, and connected with this, we are also developing our own bioreactors. So you can place after our research directly printed parts to bioreactors, cultivate custom implants, and then place it through the surgery to the human body on the particular place. what we did already is also palatal cleft. We used digital data from the unborn child, so used diagnostic data before the child was born with a woman, pregnant woman, and we designed it. According to those digital data palatal cleft plate, which was placed to this child mouth. And this is very important because this suction reflex is very important at the beginning, because newborn should drink milk immediately to have some feeding and nutrition. So you see the several designs, and on the previous slide, you see that we also used biomimetics principles using biomimetics designs. Another story, we used polycaprolactone material for designing tracheal implants. This was very special implantation because implant was placed there, tissue was grown and healed, and then we placed this implant out. So this was a doc which a surgeon, veterinary surgeon, they asked us to help to this dog because otherwise it's over. And we tried to manage this implant printed used bioprinter. And on the right side, you see the dog with the family of my colleague, vice head of my department. So the story was successful at the end. So this was our stories, and I have to say that we are happy that our research not stayed in our labs and at the university, but we applied our successful outputs to the clinical practice. So thank you very much for your attention.
Thank you, Radovan, for your non-traditional presentation. You are doing a very helpful and stunning job. Very interesting interconnection with digitization, and which may have surprised many. And we will return to this in the discussion shortly, but now move on to the last speaker, Richard Kita, who will introduce us the complex art projects and the individual background tasks. Richard, please, the floor is yours.
Thank you very much for the invitation. And thank you for taking words. And as Thomas said, my topic is related with interfacing in arts, especially in media arts. And I must say in the start of presentation that I'm a vice dean in a faculty of arts in Technical University in Košice here. And we really struggle. It took maybe a couple of years that we established a new media studio or media art studio in our faculty, and also we try to run the new core lab. So we can start the presentation, and I will continuously explain the task we start. So my presentation content is based on introduction of media art content and context. And I would like to say first that it's a very vast area of approaches in the art and creative disciplines. And but the very basic thing is, or common thing is, that it's based on interdisciplinary thinking or overview. Next is also this media art history, just very few examples which are related to some special interfaces we use nowadays in arts and maybe in creative processes. Then also complex artistic projects which are mainly from the worldwide spectrum from or the context of media art. It's a very huge area and very inspirative for when looking precisely more deep how it's related to other fields of expert fields or social fields and so on. And the next 2 points are related to this core lab I mentioned before, and also art design practice, which was the part of so-called EDASN project led by Ars Electronica from Linz, Austria, and we were the part of this consortium, and it was really, really big experience, and so we can follow. So this is just illustration thing I will say later. So next, please. So as I mentioned, this media art context nowadays has some of the very crucial or key aspects, and it's based on complexity and interdisciplinary approach. So you know, when the art is somehow, as from historical point of view, or during the decades, especially 20th centuries, was very explosive in looking on typology of arts and its application, like applied arts and architecture, so on. So the complexity is here, and it's more and more needful when looking at the process of art making. Then also synergy among the different input fields. I think it's clear when we speak about interdisciplinarity, and the very crucial is also artistic individual experience and creative practicing itself. Also, when we spoke about different fields, ecology as a special field, which is related to everything, I think, and not even also in arts, it's very high topic used by a lot of media artists nowadays. So this digital versus analog natural environments, we will see some examples then in the presentation. It's connected to sustainability and diversification of the process when practicing arts, and also which is maybe not so developed in Slovakia, and we work for that also in our departments for permanent co-education process and so-called audience or users development when we speak about interfacing in art. So from media art history, I just picked 4 examples which are very important when thinking about the interfacing in art. So in 54, in 20th century, there was a Robert Everett, who one of the inventors of U.S. Army, or related to U.S. Army, and he came up with the light gun. It was devoted to so-called SAGE project, which was air defense U.S. Army strategical thing. And this is not the only example that media art technologies or technical devices or technical background for media art is more or less connected or interconnected with the more or less U.S. Army or Army militant laboratories. So it's somehow also we sometimes with colleagues we make a fun of it, that we are here for some humanization of the weapons. So this is literally said. So please, next slide. That was first Morton Heilig as an inventor and cinematographer. It was in '62 when he came up with Sensorama, and something which is interesting when speaking about what was the first, if technology or art with using technology, or it was amplification of this technology by artists. And this is the second option, because he came with the special device, let's say some kind of archaic VR machine for immersive experience when viewer is looking at some movie and he's surrounded by other dimensional thing like smell or shaking, or like as we know from 5D cinemas maybe today and so on. So this was the first prototype and very successful one. And he began then after 60s to develop that, and they came also other inventors with other technologies then. So the other one was like Ivan Sutherland, American inventor who came with the ultimate display in 65, and then it was developed over the decade. And it was really like a father of VR or AR technology in the 60s. So then we will see another approaches in this VR, but this was it was also somehow this typology was coined by that inventor. Another kind of prototyping or interfacing arts, we can consider also Polish-based or Polish-born artist Edward Ignatowicz, who built the Sensor in 70s, and it was devoted using AI, very early AI technology, and in a robotic and as a robotic sculpture. So as an original piece of something which is multi-sensorical object reacting on viewer inputs. So it was in the history. There is a one curator, very famous one, and her name is Sasha Reinhardt, and during the 60s, she prepared one very famous exhibition, and with also comprising this such type of arts, and she told in a lot of interviews about this Ignatowicz that was a very important moment in the history of media arts. So this was there was 4 examples when we will speak about how they developed during the years, and also I just skipped maybe 30 years or 40 because there is a huge vast area of examples and artists and the artworks, and just pick this latest decade things who are very interesting when we consider art as a tool, as an interface, as immersive thing, and also, as I spoke about the tool, it's a very advantage thing when we can make and change the content during the contents during the process of interaction between viewer and or user or art concept. So please, we can run some of the videos. There are 8 of them. I picked them from the point of typology we use today in the media art, and maybe there are some longer and shorter, but I will comment during the playing around 1 minute per each. Adrian M. Claire B. They are the couple duo of the French-based duo who are really inside of the programming interactive systems for choreographical and theatrical purposes. So they used actors, programmers, and designers to came with the complex artistic project, which is a public one or is in the gallery space or theatrical. More or less, they are a lot of authors of indoor installations. So I mentioned this new media studio in Košice at the Faculty of Arts of Technical University of Košice, and these are quite big projects for students maybe, or for our specific conditions here, but some of the principles and examples we also run within the studio as we can. So this is quite big inspiration also to work in the field of architecture or design or cross borders. All this digital material is interactive in real time. So we spoke about the real-time graphics running on PCs and softwares, especially established for such performing. And I have to say, when we skip to another video, that such approach is somehow also used in a different field, like in the context of arts, because we can see it also. It's more or less in abroad countries, but used for like chill out effects for people in the public spaces, like Radovan said about this medicine. So sometimes it's a kind of art therapeutical way used, and with some utility, which is not very common for art, which is free, yeah, in general. Another example is Reiji Ikeda, his artist who was invited here in Slovakia, also in Košice during some special events, or his artworks were placed also here during the European City of Culture 2013, as Košice here. And this is a very nice example of connection between art and science, or especially in that case, working with mathematicians and some other algorithms which are not useful or not common in the media art field. And he came with a lot of such spectacular 3D projection, sometimes kind of aggressive maybe look, but working with the data. So he combines the 3D, 2D graphics with algorithms, and this is a video which comprises different artworks of this artist. When speaking about the Japanese, maybe in VDR, they're a very special category of how they design their works. They're very polished artists, we say, because very designed, well prepared designed, and if you have such abstract thing, they very relied on the technology aspect and background of these artworks. We can skip to another video. This one is also from typology of media art. It's quite often used as we spoke about the specific video mapping tools. And this is a very nice example of combining different approaches when considering the main artistic concept. And this is a video teaser of a project when the robotic arm is combined with video mapping and dynamic video mapping, which is not so easy thing to run during some performance like that. Like in history, artists work also with these optical illusions. It's a never-ending story with that, so we can see also such type of dynamic optical illusion maybe. So somehow, as we speak about art as interface topic, it's also kind of interfacing or something which can be adapted with other artists, with other concepts. So it's kind of art tool, say. And maybe when we spoke about Ignatovic, first cybernetic sculpture, there is also another very important person in the history of media art. It's Stellark, Australian artist who also is very well known when speaking about these robotic based performances and some body extensions and so on. So maybe we can speak about to another video. When we speak about connection between, or the very thin border between design and art itself. Sometimes designers got problems with artists and vice versa, because it has its own reasons, yeah, for that. Also, mainly design is utility thing, yeah, it's useful. Art doesn't have to be useful, and this is a very nice example from this Sweden station project, foundation for cancer patients. When we speak about some ad, yeah, some commercial, and it's interactive thing, very funny, working with very serious topics. Yeah, so as we have before the inputs from colleagues from today, and they also speak about this somehow applied in the, not just in laboratory stuck thing. So it's also a very nice example of how art can be in the public space, can work. Yeah. Back to that. Ivan Sutherland first head-mounted display. This one is some very fresh young geek freak studio called, and we skip to another level of typology in media art, and it's a Tilt brush studio for VR, very well known from Oculus Quest technology, and just a very, what you see is everything was made in this 3D space, and the artist got control for this 3D space and animation. So he is a part of this animation in this VR or mixed reality thing. Another video is also devoted to some other, maybe more commercial-like tilt brush using, and tilt brush was the part of Google project a few years ago, and now it's commercialized for this, for instance, this Oculus VR headset. This video is like a demonstration of a combination of two two views, from the view of the artist or user, and the video how from reality. So you could not see it like that, the situation, but this is for demonstration of how it works. And when we spoke about the co-education process or audience development, I think it's very, very nice, and this is very advantage of the media art field, that people can touch it maybe, or can participate or interact with the artwork itself, or maybe within the concept of arts, of artists especially devoted to some topic here. So this is very nice when playing with kids and teaching in some creative way and showing the examples. So this is also very, very, very strong and powerful tool for let's say every field, not just arts. Yeah.
Richard, we have last minute left.
Okay. So we can skip the video maybe, and also there are some. We have 1 minute. I heard well. 1 minute left. Yeah. Okay. This is we can show very shortly this video, the last one, which is from the German duo Quadrature. And it's about looking for equilibrium state, and it's a very nice combination of this analog and digital system. When you see the sculpture, the minimalistic plates of steel, made of steel, and there are some servo motors which are interconnected and with such steel very thin ropes, and these two stones are moving. When moving the plate, the stones are moving and trying to get the sculpture to equilibrium and 0 point. This is German duo, and they also all of their works are devoted to art and science practice or art and science field. And this is also a very nice example of interdisciplinary approach and thing which can be like a demonstrative thing for experts from design, architecture, from art, and maybe physicists and so on. So just a very one of the example of this area now. Also, from the point of typology in media art, it's we speak about some auto-interactive stuff. Yeah. Okay, if we have some time, we can run through the very few slides. And this is this I mentioned about this Ars Electronica project. So we got also cooperation with Faculty of Arts and Technical University, so you can see some slides. And this Core Lab, we prepared such immersive room with specially designed for Visit Košice organization. And then this is the very big project we started in 2019 and still in the process, and this is the reconstruction of Museum of Modern Art of Andy Warhol in Medzelaborce, which is the northern eastern part of Slovakia. I'm sorry. So maybe no. So this is the first museum of Andy Warhol in the world, and established in the 90s, and the second one in the world now. Thank you very much for your attention.
Thanks, Richard, for the insight into the art. It looked really great. Thanks to the speakers for very inspiring presentations. And we can now start the discussion. First, let me introduce our panel of experts, which is composed of 3 experts. The first being Isabel Nepomuceno from the Universidad de Sevilla. The second expert is Daniel Sieber from the MCI, And the last expert is Gualtiero Volpe from the University of Genova. Let's go in order, as the first topic was devoted to data processing. What is the experience with the use of open data by our panel experts? What is the validity of such data? Do any of the experts want to answer? Isabel or Gualtiero?
Hi. I'm going to start with your question. From my expertise, I worked with open access data from the beginning. In my research, I started to analyze gene expression profiles from public repositories of machine learning databases because my background was in engineering and computer science. Nowadays in genomics, the number of initiatives to provide open access data are increased, as for example, Gene Expression Omnibus, which is an international public repository that archives and freely distributes microarray, next generation sequencing, and other forms of omic data submitted by the research community. In the clinical domain, because my expertise is in the analysis of omic and clinical data, in the clinical domain, I think there are fewer initiatives, but we can see, as for example, Fusionet website, which is managed by the MIT. It stores, as for example, the MIMIC database, among others. This database is a freely available database comprising the identified health-related data associated with patients who stay in critical care units. This database is public available, but you have to apply for access. You need to submit your personal details and a report of your project. You have to sign the data use agreement, and to do an additional training course about the use of data. With this, I mean that in the medical field, the data are really sensitive and they are surrounded by protection agreements and laws. And for this reason, it's a hot topic now in machine learning applied to clinical data. The generation of synthetic health data to build machine learning models that need to be trained by feeding a lot of data. And in this sense, for example, the Elixir, the European Initiative for Life Science Resources, has the synthetic data team in the machine learning focus group. I don't know if answer the question.
Yeah, thank you. And did you also mention any application in your countries that use open data?
Okay, in my country, open data, I think in the north of Spain, there are a project about the sequencing of patients from the Basque countries, for example, that it will be published in a few months, I think. And okay, if you are going to the website of our government, we can download a public data set about healthcare, I think, about procurement and costs in healthcare. I'm not sure, but there's something about it.
Yeah, thank you. Thank you very much. Gualtiero, would you like to add from your side? So I think you are muted or something. No. Probably.
Can you hear me now?
Yeah, now it's okay.
Okay. I just add one short thing to what Isabel already said. So I'm working into, let's say, computational analysis of human behavior. So, for example, I work on human movement, full body movement, for many different applications like art, for example. So we were talking about art today, but also education and also rehabilitation and so on. And so we have similar problems to what Isabel said, because we need a lot of data, for example, to train the machine learning model. And of course, we have problems of privacy and data which are sensitive data and so on. One more problem that we have is ecological validity, because what is called ecological validity. And I mean that when you do some technologies for analyzing human behavior, you need to collect data which are representative of a behavior that you want to analyze. So you need to create a kind of experiment to put people, participants in a real situation. So not in a lab environment, but in something which is as close as possible to the real life. And so, of course, this is complicated because it is difficult to keep at the same time this ecological validity and to put all the technological devices which are needed to do a good analysis. So this is one more problem. And another problem is annotation and labeling. So to get labels which are valid, so that can represent in a good way what is happening in this kind of interaction between people. And this is difficult because you need experts, you need psychologists that annotate the data. So it is very time consuming and not so much reliable sometimes. So.
Okay, great, thank you. Thank you for the overview. If we reach the area of health, it was already mentioned slightly, but Isabel, how does the digitalization of the use of data affect in general the clinical care in health systems? That what are the challenges?
Nowadays, clinicians have a huge amount of information to exploit, and it can provide new insights into disease treatment and prevention. The huge amount of data is provided by two main domains, biology and the clinical domain. In biology, we have the high throughput technologies as next generation sequencing that have transformed genetic and genomics. We have now information at DNA level, RNA level, protein level. This technology has transformed research. For example, in the beginning of 21 million human genomes were sequenced, and this sequence data has provided the pharmaceutical industry with many potential drug targets to research in several diseases. Omic data is one of the major generators of big data, together with astronomy, YouTube, or social networks, as for example, Twitter. In the domain of clinical data, clinical medical data, we have a huge amount of data too, provided by the digitization of patient-associated data from health electronic records, medical device, medical imaging, text mining from literature, and so on. This omic data, together with the clinical data, establish a new scenario or new paradigm named precision medicine. The goal of precision medicine is to combine the use of clinical and omic data to make clinical decisions that are adaptive to individual patients, including more accurate diagnosis and treatments, safer drug prescriptions, better disease prevention that at the end can be translated into a reduction in healthcare costs. In this scenario, we are faced with two challenges: the challenge of information management and the challenge of the inference of knowledge from this information. In the first case, these new paradigms requires implementing platforms and algorithms for big data management and integration, ensuring that patient omic data can be extracted. In this line, there are several initiatives. For example, here in our regional government, we have the personalized medicine plan to develop the informatic infrastructure that store omic data, which are interoperable with electronic health records. This bioinformatic platform provides an automated system for the discovery of disease genes in the population of Andalusia. In the case of clinical data, interoperability and integration are crucial and necessary, particularly given the large heterogeneity of the data collected by each doctor in each hospital. It's crucial to establish universal standard and control vocabularies to facilitate data sharing, and to ensure that clinical data are collected. As for example, we have Semantic Health Net, that is an initiative to develop European semantic protocol for clinical data. I mentioned the challenge of information management, and the big challenge is the inference of knowledge from this data. To reach this challenge, we have powerful machine learning tools, but machine learning for healthcare is different. I mean, machine learning has accomplished wonder things on well-posed problems where the notion of solution is well-defined and the solutions can be verified easily. But, as for example, the area of computer vision, wherein a few years ago, enormous advance has been achieved using machine learning. It's easy to define the task. We have machine learning models to find a car or a cat in a set of images, and it's easy for a human to verify the solution. In the area of healthcare, the problem is different. The problems are not well posed, the notion of solution is often not well defined, and solutions are hard to verify. Let us consider COVID-19. We would like to develop machine learning models that can enable clinicians to take better care of their patients. But it's difficult because we need to identify what are disease trajectories for patients with COVID, when is the right time to intervene on a patient, and how and for how long. All of these are complex problems to define, and currently there are several research labs, as for example, Michaela van der Char lab, to address this kind of question. They have an ecosystem of tools to answer this question. And finally, let me mention the initial training network in which I participate, called Machine Learning Frontiers in Precision Medicine, to train new researchers to focus on the application of machine learning methods to health data.
Thank you, Isabel, for your comprehensive response. And I would like to ask Daniel, you've been working with a large medical device company for the last decade. Can you comment on how digitalization has changed this industry, how patients benefit from the transformation, and where you see the challenges ahead?
Thanks, Thomas. Yeah, I think it's been quite an interesting ride for the medical device industry, and it's really, and Isabel has pointed at some of these things already. 10 years ago in clinics, we were working with paper records and nothing was standardized. And suddenly we're living in a world where much of the data, at least, is standardized, is centrally comprehensible. We've also seen, and I think this was pointed out nicely by Radoslav and Radovan, we have this whole open science community, which has made their code available publicly. And so that has brought this push to the maker scene, and then to the additive manufacturing, and then already existing technologies were suddenly getting this industrial boost. And I think we're really seeing a lot of interesting new technology coming out of that. We're seeing more individualized patient care, which was fantastically demonstrated by all of the colleagues already. I think when we talk about challenges, I think regulation is a central thing, where also I think we as a European university need to be very active, because we've created all of these new possibilities, and suddenly we have the cybersecurity risks. We need to regulate all of these new aspects. We have agile project management happening in companies, And so I really think that there will be a very interesting experiment in society to make this compromise of risk versus benefit, risk versus innovation, because one thing is clear with all of what we've discussed, there's nothing that is free of risk, certainly. And I think we can make our contribution as independent universities to that discussion in society. And I think that's an important challenge ahead when we talk, for example, about hospitals producing medical devices now, and then at the same time we have the medical device regulations coming in, which make it so much harder even for big companies to bring medical device to the market. I think there's very fascinating challenges ahead that we can help with.
Yeah, regulation is nowadays a very important thing, I would say. MCI recently launched a digital twin lab. Can you explain what happens in such a lab and how it helps to solve real world problems?
Yeah, so basically a digital twin is a digital copy of a physical object. And then the fascinating thing about that is that you can take the digital object and expose it to a simulated environment, and then experiment with different parameters. And a lot of these technologies, simulation technologies, have been around for a long time. But again, we're reaching a time when a lot of these things come together with VR technology and so on. And so my colleagues, Professor Kraxner in R&D services and Professor Merle from the mechatronics department, they started the first collaborations with industrial heavy machinery, where they use this kind of digital twins lab to optimize machines with the idea of reducing lead times in development. So you're trying to get these down by doing simulations in silico. And for me, this is fascinating because medical technologies have very long development cycles. For complex implants, you can talk about 5 years and more development lead time for the next generation of an implant. And so this is very fascinating if we can do digital twins of implants and then test these in the environment of a digital anatomy model. And that's a field that I've been very invested with in the last decade. Then that can have really good impact on our ability to innovate and our ability to provide the right implant for patients.
Great, thank you. Would you like to add something from the row of our speakers? Let's, for example, if so. If not, we can step into the art, but feel free to let's say raise your hand and so we can pass you with the word. If we step into the art, I will ask Gualtiero, what do you think? How theories and concepts from arts may inspire, inform, and drive technological innovation, and on the other hand, how technology can contribute to art by extending its language and providing new ways of expression?
Yes, of course. So thank you very much for this question. And with respect to the second part of your question, I think that the talk that we have just seen by Richard provides many examples of how technology can help to extend the language of art. So you have seen a very large survey of several installations since the mid of the previous century, the last century up to nowadays. So this was quite evident, I think. The other part, the first part, I will try to say something now. So how art can inspire technology, and I will just tell you a few examples just to make you understand how art can be, let's say, a driver for innovation. For example, in 1999, we met with Luciano Berio. Luciano Berio, you know, is a famous composer of the 20th century and of contemporary music. And he asked us to make a system for an opera that he presented at the Salzburg Festival that year. And so we were asked to do some tracking of actors on stage with the technologies that we had at the time, and to control some processing of the voice of a singer that should change in the different parts of the stage. So we did this work with him. It was quite a long work that lasted for months. And at the end, what we learned from this experience was a list of requirements for some software for real-time analysis of movement, of sound and music, and for a kind of integration of all these data streams into a complete analysis, let's say. And so we went on with the development, and we released after a couple of years the IceWeb platform, which is still used, so after 20 years, as a platform for a real-time and multimodal processing of the data streams from different sources. So this is an example of how an artistic experience was a driver for technological development. One thing that I would add, just thinking to what we said today, is that art is not just this, but art could be also, let's say, a test bed for collecting data. So, for example, there are studies on social psychology and so on that say that, for example, a string quartet is a kind of model of a team. So in an organization, like in a company, of a small team of professional people that work together. So you can, for example, record the data and try to do some scientific research to understand how a string quartet, for example, works. And the insights from this data could help you to understand how a team, for example, of programmers or professionals work in a company. So art is also kind of metaphor of real life, let's say. And so this can be a testbed for collecting data that can be used for understanding more about the mechanism of our interaction, let's say, the interaction with people. Final thing, just not to take too much time. Today we talked about health, and art can be also a driver because it is a kind of motivator, let's say. So it gives motivation for improving systems for rehabilitation. For example, now we have a project which is funded by Compagnia San Paolo, which is a main bank in Italy, which is about rehabilitation, motoric rehabilitation. So people with injuries that cannot move, or older people that have problem in moving. And so, for example, they have to mimic and reproduce the movement in a picture, so in an artwork. And this can be a motivation for them because they see this scene and they try to reproduce it. And so this gives them the motivation to move. And so this makes exercises less boring, let's say, and more interesting to do. And this can be, let's say, a way to improve rehabilitation systems. This is just 3 examples of how art can improve, let's say, our technologies and our lives too.
Thank you, Gualtiero, for your point of view. And we've got one question from the chat box for Richard in Slovak. It is Richard. How we can inspire K-16 educators to consider this type of interdisciplinary projects in formal or informal education?
Mm-hmm. I hope I understand the question. But can you repeat it, please, Thomas?
Yeah.
To be...
I will read it once again. how we can inspire K-16 educators to consider this type of interdisciplinary projects in formal or informal education.
Mm-hmm. So maybe there are some more ways how to do it or how to start with such things, because as I mentioned at our faculty, within the media studio, we try hard, or it took a lot of years to establish that and to run the studio activities, and it's not easy thing, but it's all maybe at this point it's about the people and some communication. I think the level of communication, because we got a lot of information around, and as Daniel Zieber spoke about this, which was explosion of possibilities maybe, and so in the arts or whatever in society, it's a really a lot of opportunities or possibilities, at least in this digital or virtual environment as internet and so on. And but the challenge is how we can pick the thing we need at the moment and how we can interconnect it with something. And this is very hard to, maybe this is not so much so hard to teach or to inspire teachers or lecturers how to work with kids and so on. And but something is related just for the experience, very individual thing, or we spoke about this personalized agenda, and this is something which is sometimes mysterious, let's say, because it's not, it can be countable or not, it's not exact thing. And this psychology moment is also very important in arts, and some errors and so on. So combining these two things, like subjective and objective things in some special way, it's a big challenge. I hope I answered the question somehow. Sorry.
Yeah, I see. I suppose. Thank you very much for your response, Richard. And would someone add something to today's discussed topics? There is the chance.
Yeah.
Yeah.
Go ahead.
Okay, thank you. I just want to thank you all for your comments. It was very nice to see and listen to the different point of views to our research and new challenges in our field. So this is just a short comment from myself.
Yeah, thank you.
Yeah.
Daniel.
Maybe one comment, because I think a lot of young scientists are watching today, and so I want to, because you brought up this topic of open data, open science, I can only encourage that all of you think about that, and really every region right now has very exciting open science projects, and if you're interested, really think about participating in those. You will learn a lot. There is sometimes this misconception that when something's open, it's not entrepreneurial in a way, and that's entirely wrong, because like there's a lot of rich people in the world who participated in this open science movement, and personally I can just say that from my experience, and I've done open data projects with human anatomy data, that this has been so rewarding, because you put your data out there and people from all the world can look at it. They will find your bugs and they will give you a chance of fixing your bugs and making things better. I think this is just amazing, and I would really encourage that.
Yeah, thank you, Daniel. Okay, if no one, but yeah, Radovan.
Thank you. I just want to say one comment to Daniel's reaction. I really can see in the future some in silico model of the human body with all those interactions, anatomy, everything, and you will put there something and you will see how it will behave. It's fantastic. So maybe we will get there sometimes in the future.
We'll hope. Maybe very soon. Who knows? Yeah. Okay.
Thomas, you're muted now. Sorry.
Yeah. Thank you. Thank you. The time is up. Special thanks to the speakers and panelists for valuable information and insights. We also thank to all the participants for joining and spending time with us. I believe that this webinar has enriched you in your further work. On behalf of the entire Compass team and Technical University of Košice, thank you again and enjoy the rest of the day. Thank you. Bye.
Thank you.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
Thank you.
Bye.
Bye bye.